Hey there, thanks for tuning in. If you're a parent, if you're a teen, or someone worried about hip pain, let's talk about something called slip capital femoral epiphysis. Yeah, that's a mouthful. Most people just call it SCFE. Now, SCFE is a hip condition that mostly affects adolescents, especially those who are a bit overweight. Imagine the ball at the top of your thigh bone, called the femoral head, slipping slightly off the neck of the bone, almost like ice cream sliding off a cone. It sounds dramatic, but it's actually one of the most common hip disorders in teens. So why does this happen? The exact cause isn't always clear, but it's often linked to rapid growth during puberty, extra weight putting more stress on the hip joint. Hormones might play a role too. Sometimes it can happen after a minor injury, but a lot of the time it just sneaks up. Let's talk symptoms. The classic sign is hip pain. The pain might show up in the knee or the thigh instead. You might notice a limp, stiffness, or trouble walking. Some teens say their leg feels like it's turned outwards, or it's just hard to move. If you notice any of these things, especially if your child is limping or complaining of pain for more than a few days, don't brush it off, get it checked. Diagnosis usually starts with a simple conversation and a physical exam. The doctor might ask about recent growth spurts, weight changes, or injuries. X-rays are the key. They show if the femoral head has actually slipped. Sometimes an MRI is needed if the X-ray isn't clear. Now let's talk treatment. SCFE isn't something that gets better on its own, and it can get worse if ignored. The main treatment is surgery. A small screw is placed to hold the femoral head in place and prevent further slipping. Sounds scary, but it's a routine procedure. The goal is to stabilize the hip and stop the pain, and most teens recover really well. So what's the outlook? With early treatment, most kids get back to their normal activities, including sports. But ignoring SCFE can lead to serious problems like arthritis or permanent hip damage. That's why catching it early is so important. If you're a parent, I get how scary this sounds. But remember, you're not alone, and this is a treatable condition. If you notice any warning signs, talk to your doctor. And if you're a teen dealing with hip pain, speak up. Your body is worth listening to. Thanks for watching. Take care of yourselves and each other.